On behalf of the House Democratic Caucus, I want to thank the members of the Capitol Press Corps for being here today. The end of week 13 of the legislative session is upon us. We've only got 4 weeks left of this legislative session, and we are still, it seems like every week, waiting for the folks in charge to offer up at least one bill, let alone the multitude that we hear may be coming, offer up at least one bill to help close this $1.3 billion hole. But here we are now 4 weeks from the end of session, and still nothing has come through any committee in the House or the Senate, or definitely hadn't been heard on the floor, that will actually close this $1.3 billion budget hole. And our caucus is growing ever more frustrated by it. We're afraid that what happened last year may happen again this year, which is last year they rolled out the budget, and within a few hours, instead of letting the budget lay over for a day or more so that we could all read it and study it, it was within a few hours they released it, suspended the rules, and made all of us vote on a $7 billion budget without having an opportunity to really review it. That's not the way this process should work. That's not the way our constituents want it to work. And so our House Democratic Caucus is hoping that we'll start to see some more solutions brought before us in the coming weeks, and not just thrown together in one sort of complete package at the end of session and told sort of with a gun to our head, you have to vote for it, up or down, you have no other options. That's not a healthy way to run the budget, and unfortunately we're afraid that that's where we're going to be this session. That being said, there's also some more frustration that came out as we still haven't found the solutions to backfill budget cuts. We heard this week that our public schools are looking at maybe another additional $17 million cut coming down due to what would be considered, in essence, a third revenue failure, at least as it pertains to education funding. This comes on the heels of $109 million worth of cuts that they have sustained since January. Even with the rainy day money that's come in, another $17 million worth of cuts is devastating to our public schools. And so we cannot, our schools cannot continue to maintain and sustain those level of cuts. On top of it, though, we just had on Thursday, we just had another legislative mandate passed by this Republican majority. They've now passed legislation on Thursday to require schools to do more reporting and give more documentation to teachers about how much they get paid when they already know how much they get paid. And it's going to be more costs, more administrative costs, and the Republican majority decided to pass it anyway, in spite of the millions of dollars worth of cuts already facing our schools. And so what concerns us most about that isn't isn't the overwhelming burden that this new reporting document is going to place on our public schools. It's the fact that it demonstrates a political tone deafness. To think that our schools can afford one more mandate or one more set of paperwork at a time in which we're cutting hundreds of administrators and hundreds of teachers around the state demonstrates that there's just a political tone deafness. The folks running the show just apparently don't get it, and that's frustrating our caucus. And so with no real budget proposals, I think the governor and Republican leaders are still at loggerheads over things like cigarette taxes and bond proposals, and then they turn around and offer up more unfunded mandates for classrooms this week. It was not a good week in the legislature in week 13 as it pertains to the budget. But there was one incredible thing that did happen this week, and that is how I choose sort of that's the big takeaway for me, at least this week, is that for the last 8 years, our caucus, from Representative Mike Brown from Tahlequah, has fought fervently to get coverage in Oklahoma for children with autism. He tried 8 years ago, and the insurance companies and some of the special interest groups beat him back, and we couldn't get the Republican majority to support it. But this year, thanks to Representative Nelson and Representative Brown and so many others, in a bipartisan effort, we came together and on Wednesday passed comprehensive insurance reform for children with autism. So now, in Oklahoma, when the governor signs that bill, and we hope that she does, children whose parents have been paying for health insurance benefits for years will now actually get coverage for treatments to help deal with their autism. The difference between 8 years and today is that hundreds of parents who have children with autism in Oklahoma communicated with their legislators, brought their children to the Capitol, demonstrated the effect that autism has on our families and the cost of it, and the unbelievable struggle that it is for those families who don't have insurance to be able to pay for the coverage that they need. And because of their efforts, they got a group of us to pass it. Our caucus was thrilled to be the ones that put it over the top. There weren't 51 House Republicans who supported that legislation. I think 26 or so of them opposed it. And so without the House Democratic Caucus supporting that legislation, it wouldn't be law today. The fact that these children, especially if these are children who are eligible for Medicaid, by definition means that they are very, very low-income children. They need coverage just as much as the wealthy families do that have children with autism. And so I don't believe the cost will be will be something that Medicaid in Oklahoma can't sustain, and I think the fact that we don't currently cover those children is a cost that our families can't sustain. We think that the cost, as has been seen by the 43 other states who've already required autism coverage for children in their states, the costs are very, very minimal to the policyholder. This week, or actually last week it was, Senator Sparks and I issued a letter to the governor, the pro tem of the Senate, and the Speaker, and sort of their caucuses to join us for budget discussions. Open door budget discussions with the press and with the public, and that was set for this Tuesday. With all the bad weather that rolled in, we decided to postpone it until next Tuesday, so we're going to hold the meeting still. But what the governor did was she basically said, well, we're not coming to yours, but you can come to our weekly breakfast that they have at the mansion. And so we were grateful for that, and we took the opportunity to go over and visit. Senator Sparks and I sort of laid out our proposals, which have been discussed in this room over and over and over again: rolling back the income tax cut, gross production tax indexing, expanding or bringing our federal dollars home without pushing people off of Medicaid, and looking at tax credits and exemptions. The governor seemed to appreciate those, but I'm not sure that there was any real progress made. We do not support pushing 175,000 pregnant women and children off of Medicaid and onto the health insurance exchange. We do not support that. We don't believe that is the best way to handle health insurance in Oklahoma. And so the only reason that's being offered is so that way the Republican majority can say that they didn't technically expand Medicaid, because they'd be bringing 175,000 people on at the same time they're pushing 175,000 pregnant women and children off. It's all semantics. It's all a political game. So our caucus has said all along we need to bring our federal dollars home. The Republican majority has said for years, no, the nation can't afford it. Well, finally they have abandoned that talking point. They finally agreed to come to our position and said, yes, essentially the House Democrats are right. We have to bring our federal dollars home. They're there now, except instead of just bringing them in and taking care of our folks who don't have any health insurance, they're playing games with it and saying, well, we have to shift 175,000 people off the rolls in order to make it more palatable for the Republican majority. That's not the best way to go. So what our caucus has told the governor is this: if you need our votes to get to 76 votes to raise the cigarette tax, we're willing to consider it if you will just do a straight expansion. There's no point in kicking those 175,000 people off. If you need our votes to get to 76, then you've got to work with us. You're asking us to do a heavy lift to help the Republican majority pass that cigarette tax increase, and at the same time we're going to be kicking 175,000 people off the rolls. We don't support that. But if they will do a straight expansion, which doesn't require one vote in the legislature, they can do it through rulemaking. The governor can simply tell Nico Gomez and the Healthcare Authority to bring those federal dollars home today. Not one vote in the legislature would be necessary to do that. So we've said, if you'll do that, we will have a serious conversation about the 76 vote threshold requirement. However, we have told her that we are not supportive of putting it on the ballot. We're very concerned about putting a cigarette tax on the ballot, which would only take 51 votes. But we've talked with folks in the Cancer Society and other places who share our concerns, because in the last 10 years, not one cigarette tax around the country that's been placed on the ballot to a vote of the people in any state has passed. Big Tobacco and others have defeated that at every turn. And so the Cancer Society folks, as well as us, we are concerned that if we're going to try to help our hospitals by bringing in revenue through the cigarette tax, you are jeopardizing that by putting it to a vote of the people where Big Tobacco can come in and defeat it and such. So therefore, if it is defeated, not only will the revenue not come in to help take care of the cuts that are currently facing Healthcare Authority, but it also takes the issue of any potential cigarette tax increase off the table for years, much like when the gasoline tax failed at the ballot. And so we are willing to talk about it in terms of trying to reach a 76 threshold margin to bring in the revenue today, because it's much more beneficial anyway. It's a safer vote, and it also brings in money immediately. We will have that conversation if she's willing to have the conversation in a good open faith negotiations over the expansion of Medicaid. If they want our votes to raise revenue so that they can push 175,000 pregnant women and children off of Medicaid, it's going to be very difficult for me to sell that argument back to my constituents, back to my caucus, because you see, they're asking for more revenue at the same time they're saying, let's raise a fee on hospitals, let's raise a fee on insurance premiums, and let's kick 175,000 pregnant women and children off of Medicaid. That doesn't make sense to us. There's ways you can do it. If you want to raise the revenue from the cigarette tax to offset your budget cuts, that's a legitimate conversation. But in order to pay for the Medicaid expansion, you can do things like eliminating the double deduction, which would bring in about $90 million, which would more than cover a straight Medicaid expansion. So there are other alternatives that don't involve hurting rural hospitals and hurting pregnant women and children. Other states, like New Mexico and Arizona, have done more of a straight expansion. And the reason that we're opposed to kicking those folks off is because what the governor is proposing is in order to pay for the Medicaid expansion, she's going to make pregnant women and children pay more in copays, pay more in out-of-pocket expenses, have more limits on what their access to health care is. That's not I don't believe that the way you pay for that is making poor folks have to bear more of that burden. I think there's a way you can do it by eliminating the double deduction. I think there's a way you can do it through rolling back the income tax cut. There's a variety of other ways you can do it without hurting the poorest people in the state. And so that's where we are. We think we can work out a compromise, and that's what this is all about. The governor and the pro tem and the speaker say they want us to work together. Well, they can't come to us and go, here's a bunch of bitter pills, you swallow them and help us make you swallow them. No, if you want us to work together, then let's do that. You give in a certain area, and we'll give in a certain area, and that's what we've tried to do.